Everyone, and welcome to the last in our four-part webinar series on preparing for and delivering value-based care in rural communities. I'm Tom Harlow, Program Director with Rural Health Redesign Center, and we oversee the Northern Border Region Technical Assistance Center, and I'm joined by my colleague Josh Miller, who's the Project Manager for the NBRTAC. Just a quick logistical note. At the conclusion or as we go through the presentation, we ask that you post any questions in the Q&A section of Zoom, which will be down at the bottom of your screen, and we will take the questions in order at the end of the presentation. If we do not get to every question, we will try to provide answers after today's session on the CVEN site. And this session is being recorded and will be available after today's session as well. Today's webinar, Preparing for a Value-Based Future, Tools to Help Find Your Way, will provide you with actions and tools you can use to prepare your organizations for success within a value-based care environment. We are joined today by two seasoned experts in the field of value-based care. First, Janice Walters, Chief Operating Officer of the Rural Health Redesign Center, has been leading rural health transformation efforts at the Rural Health Redesign Center since May of 2020. She has been leading the efforts of the Pennsylvania Rural Health Model since 2018. Prior to leading rural health transformation in Pennsylvania, Janice spent 12 years in healthcare leadership positions, primarily in rural Pennsylvania. Her experience includes financial oversight of a rural health system's business activities, as well as its population health activities. Joining Janice is Karla Weng, and Karla is the Senior Program Manager for Stratus Health, leading the rural-focused programs. For more than 20 years, Karla has led a wide variety of projects supporting rural hospitals and providers to improve quality and patient safety, including developing palliative care services, implementing quality management methods, preventing readmissions, and other population health efforts. So please join me in welcoming Janice and Karla to today's presentation, and I'll turn it over to Karla to begin.
All right, thanks, Tom. Okay, so preparing for value-based future, tools to find your way. Just a little context about who I am. I am with the Rural Health Value Team. That is a partnership with the RUPRI Policy Research Institute at the University of Iowa and Stratus Health. And our two organizations have worked together for about a decade now under the umbrella of Rural Health Value, funded by the Federal Office of Rural Health Policy, where we really focus in on helping rural health systems consider and make that transition to value. So we do resources, technical assistance, some research, a wide variety of pieces, but really focused in on that volume to value transition in rural communities. Just a little bit of level setting before we start to talk about tools and strategies. I always think it's helpful to start at the beginning about what do we actually mean when we talk about value-based payment and value-based care. And our team actually likes to talk about them a little bit separately, because value-based payment is the method by which purchasers hold the healthcare delivery system accountable for both quality of cost and care. So it's the financial side. So how does the government, employers, consumers, how do the payers actually pay for care? Which really kind of focuses in then on rewarding. If you're going to do value-based purchasing, it rewards healthcare providers for keeping people healthy and for providing the right care at the right time in the right place. So to be successful under value-based payment arrangements, it's important to provide value-based care. So you need to deliver care that entails a focus on prevention and wellness. You're still doing treatment, but it also is focused on helping keep people healthy, focusing on improving outcomes. Helping navigate the healthcare system is a really significant component of value-based care, integrating and coordinating care across settings, across different types of care. And then more recently, recognition and I think more of a focus on helping patients address health-related social needs. Really hard for people to be healthy and people to follow kind of treatment paths if they don't have the resources they need to make that happen. So whether or not that's transportation, food, all sorts of different challenges that get in the way of folks being able to be healthy. So the value in value-based care is derived from measuring quality and patient experience against the cost of delivering those health outcomes. And the focus on value is really accelerating. The Healthcare Payment and Learning Action Network, the HCP LAN, is a public-private partnership that's really focused kind of on the payer level, this is kind of my go-to source when I want to better understand what's happening at a payer perspective, of kind of having leadership, strategic direction, and ongoing support to accelerate adoption of alternate payment models. So they have a framework and a taxonomy that's used, and then they also do some goal setting, kind of very publicly statements around where they want value-based payment to be. So this is their most recent update of goals. They want to accelerate the percentage of US healthcare payments tied to quality and value through the adoption of two-sided risk alternative payment models. So we're beyond just attaching finance to quality metrics, or kind of that one-sided focus, but really is a strong push in the payer environment to try to get to the point where there's two-sided risks. So providers are at risk for both savings and potentially overpayments on whether or not there's a risk of trying to better improve quality and payment on both sides. So really trying to get into that two-sided component of that. And I want to highlight for you out down here this 100% piece from Medicare. So Medicare Advantage and traditional Medicare, this is a pretty big statement from CMS, in that they have said that they would want 100% of Medicare beneficiaries to be in these types of payment arrangements by the end of 2030. So previous goals have been below that, and oftentimes, particularly from a rural perspective, it's easy for rural to kind of be out of that mix because it's a small percentage of overall payments. But if they're saying 100%, that means they're going to have to be opportunities and a focus on helping rural hospitals, clinicians, and others get to this value-based angle. So we like to use sort of an analogy where we talk a lot about the road to value, and we talk about having a car that you can drive on the values. So you'll see that throughout some of my slides. And one of the things I have to comment on before we get into some of the strategies is that road conditions really matter, and it likely looks different depending on where you are. So in the market factors, we just talked about that traditional Medicare has indicated they want 100% of folks to be in accountable care relationships by 2030, but we're also seeing really significant growth in Medicare Advantage, even in our rural communities. So rural enrollment in Medicare Advantage is up to about 38.8%, almost 40% nationally, which has been really a steady increase. And in terms of a payer relationship, is much more like a commercial partnership than it is traditional Medicare. My colleagues at the Rupri Center actually do Medicare Advantage enrollment updates every year, and they have fantastic state level, county level maps and data tables. So there's a link to that in the slides when you have those available, if that's something you want to look into. So we have traditional Medicare, Medicare Advantage. We also see a wide variety of differences across state Medicaid program redesign. So a lot of state Medicaid programs are going into managed care. Some state Medicaid programs have accountable care organizations or other value type payment structures. Some states are pretty advanced in this. Some states aren't really going that direction at all. So we see really wide variation in terms of state Medicaid program design. And then finally, commercial and private insurance. There's a wide variety of value-based care incentives, but we definitely are seeing more of the commercial contracts go that direction. So increasing of costs and patient risk sharing comes into play, as well as kind of really focusing in on some narrow networks or the types of different road conditions we see in terms of the market. So you have to find your own pace, that different paces in different places from different payers. So want to share with you some kind of thoughts about how do you consider opportunities to start the building momentum if you're really kind of sitting at the starting line, or to think kind of more broadly about how you move forward if you're, have one toe in or a whole foot or leg into the value-based care arena. So if you want to build a car, or an organization that's going to be successful in value-based care, here's some key components we encourage you to be thinking about. So certainly leadership is always at the top, and they're really the driver of this. So you need to help, as leaders, we need you to facilitate, under support community planning, coalitions, and connections. You'll see this throughout kind of my slides, that this really, to steal from Hillary Clinton, takes a village. This is really hard for an independent clinic or hospital or healthcare system to do in isolation. So there really needs to be a focus kind of on that bigger picture, community planning, coalitions, connections. We need folks to identify resources and invest strategically, and to engage staff, clinicians, patients, and caregivers. We're doing some work with a group in North Dakota, and that was one of the primary lessons that the CEOs came out about, that is that we just need to provide education, education, education. We have to have across our organization people talking the same language and understanding value-based care and the direction that we're going. The engine is the finance. This does take finance, but it might take multiple types of fuel to get you going. So I really encourage folks to be looking for potentially pilot opportunities, grant opportunities. This is a place where grant dollars can be really helpful to try to get the infrastructure in place. You know, getting short-term grant funding is different than value-based care financing, but the grant piece of it can often be helpful in kind of getting the infrastructure built, and recognizing that it can take time to build up speed, that you really have to look for opportunities to pilot and test. And for example, some folks might focus in, if they're thinking about care coordination strategies, maybe they pilot it with their uninsured folks where they're not getting actually any value-based payment attached to it, but they are a population that they're essentially at risk for. So how do you start to pilot and think about this if you're not in any value-based care arrangements? And then also encouraging a balanced set of indicators. That's one of the things about value, is that we're not just looking at the bottom line financially, which is obviously extremely important, but we also have to be thinking about patient experience, a variety of quality metrics, employee engagement, all the types of things that you want to make sure to help everyone's going the same direction. When we think about having kind of a framing around our engine and our driver, some of the strategies to improve health and value we encourage you to be thinking about are ways to address what I would call the pressure points. So inappropriate emergency department visits, increasing preventive services, how do you focus in on care management, care transitions, behavioral health, all areas where we see lots of opportunity to better support patients in their homes or keep them healthy, and try to get them the most appropriate care in the most appropriate place at the most appropriate time. We also, one of the key important pieces around being able to successful in value-based purchasing is sort of what we're calling reinforcements and safety features. Data analytics is really critical to be able to support your provider teams, to be able to manage that health of that population. So data analytics, health information exchange, and then appropriate coding and billing is also a really important strategy. So particularly in critical access hospitals and rural health clinics, because you already get paid differently, there hasn't been the same attention and focus on complete and accurate coding and billing, because it doesn't have as much impact on the way you've traditionally been paid. But the way that the direction that things are going, with a focus on using claims data and other information to kind of look at risk scores, ensuring that appropriate and complete coding and billing is really a big opportunity for a lot of rural organizations. And then finally, the wheels of your car to make it drive is really community partnerships. It's pretty hard to move past the line if you don't have good tires. So how do you kind of build that up? How do you help keep everybody going the same direction, have strategies in place? How do you maintain tire pressure and spread resources to meet needs through appropriate agencies or partners? Particularly when we start talking about social drivers of health, which have a bit more information in later, is what it doesn't have to be up to the hospital to address everyone's needs, but how does the hospital or the clinic help connect to the resources in the community? And then how do we help ensure that the resources in the community are available? So lots of opportunities and work to happen to make sure that those things are available in your community. So if you have a car built, those are kind of key strategies to be thinking about. How do you start to map that road to value? So I will highlight, we have the Rural Health Value Team has a value-based care assessment tool available on our website. The link is here. It's designed to assess 80 value-based care capacities grouped into 8 different domains. So you can kind of see the key areas here on the slide that we assess. This is really intended to be much more of a strategic planning tool. It's not like I'm going to click answer 5 questions. There's 80 questions for you to think through, and we really encourage folks to think about this as a team. I actually think that the conversations that organizations have while they're completing the assessment is more valuable than the actual assessment and the report that comes out of it. So if you do complete the assessment on the, there's a portal that you can click on, you can fill it out in an online survey. And then we would provide you a report that outlines strengths, opportunities, and considerations when you complete that tool. And then we frequently can do follow-up calls and support depending on what your needs are or questions you have related to that. And I know we've been working with the Northern Border team to make that service available as well. So an assessment tool to help you start to think through those strengths, opportunities, and considerations. We also on the Rural Health Value website have tools and resources aligned by those same 8 domains. So if you identify that performance improvement is an opportunity, we have a set of resources available related to performance improvement. So just a connection to where if you identify something you want to focus on, some tools and resources that might help you take those next steps. When you think about aligning strategies with value-based care incentives is one of the next pieces. Again, even if you're not fully in value-based arrangements yet, there are things that you can be looking forward to that might be supportive in that process. So reducing potentially avoidable utilization is always on the top of the list. So again, primarily emergency department visits or potentially folks where if they had care in a different setting, perhaps may not have ended up in the inpatient. So how do you kind of focus on those things? Care coordination and care management often help reduce that avoidable utilization, but also kind of help people navigate through the healthcare system. Increasing use of annual wellness visits and preventive services. Annual wellness visits are really an opportunity to kind of make sure that identify different care gaps that folks might have. It also helps you kind of look at what are the quality metrics that you're focused on. Are there things that you're capturing while folks are in your office for that? Ensuring access to behavioral health services, we know is a challenge in almost all rural communities, but is really critically important to improving quality and value. And then thinking about and monitoring and improving on performance quality metrics. So we know that there are a lot of quality metrics out there and that it can be really hard to figure out where do you put your focus. So I want to share with you this article that I have linked that was put out earlier this year from CMS Leadership. And they have laid out what they're calling the universal foundation for quality measurement. So I've been in this space a long time, long enough to be a little bit cynical. That CMS has been talking for at least a decade, maybe longer, about harmonizing or aligning quality measures, a variety of terms that have been used over the years. But this actually feels, in my mind, feels like a line in the sand. They have laid out a set of adult and pediatric measures where they've said, here's the measures that we want to align around. We want to get everybody the same definitions and using kind of the same structure for these measures. So if you're trying to think about prioritization, I'd encourage you to take a look at that article, take a look at what those measures are, because if you think about the reach of CMS, it's not just traditional Medicare, it's also your Medicare Advantage and your Medicaid and your CHIP. So there is some pretty big reach if they're actually able to move that forward. So it's still a bit aspirational at this point, but it does feel like that's a direction that they've really tried to start to shape around. So I encourage you to take a look at that. And then the last strategy to encourage people to really be thinking about is how do you understand and utilize claims data to help manage care? So by participating in some of these value-based care models, one of the most valuable pieces you get from that is that claims data. And then how do you translate all that data into useful information? So there's lots of vendors and data analytic platforms that can help you do that. but it's also just really important to think about kind of processes of care and how you deliver care that helps that. So one example that I think comes to mind regularly is you might think that somebody is only coming to your clinic for primary care, but you see the claims data and all of a sudden you realize that they actually have been seeing like 5 other providers that you might not have been aware of. So how, as is particularly in the primary care space, can you use that data to best support improving health for the patients that you see? Building partnerships is another critical kind of strategy moving forward. Pretty hard to be part of any value-based care or value-based payment models without volume. So most of these require a set number of lives of patients that you're seeing in order to have the kind of math work. So you have to work in networks, either for shared value and then also to maximize efficiency and resources. So oftentimes we'll see groups that will share data analytics or other shared services. There'll be peer networking and support. You might be able to leverage and partner with payers. So partnerships across like organizations are critically important, or across kind of a clinically integrated component are important, but so is community engagement. So we really encourage folks to kind of pause and be really intentional about their community engagement strategies. So I've spent the last 20 years working with rural healthcare systems. Everyone I've been in has a ton of community engagement happening. It's part of the DNA of rural healthcare organizations, and I think that's one of the advantages that rural healthcare organizations need to kind of capitalize on as they're thinking about value-based care. But to do that, we encourage folks to really pause and take an inventory and an assessment of what current community engagement activities are you currently doing, and how do they align with value-based care strategies? Are there things that maybe it doesn't make sense to do anymore that you can put resources somewhere else? Or are there things that really do align with value-based care strategies that you want to amplify? So a lot of opportunity and a variety of kind of ways to engage communities. It doesn't all have to be all in collaboration. All in collaboration is fantastic, but sometimes you just need to cooperate and share resources, or coordinate and share information, or network and know who else is out there. So our team recently released a community engagement resource guide that has lots of tools and resources, as well as sort of this little infographic that helps you start to think about how that aligns with value-based care. And most importantly, one of the opportunities with community engagement is thinking about how do you improve health and reduce disparities by addressing social drivers of health in your community. So I really like this graphic. It's from the de Beaumont Foundation, an article that's a few years old now. But again, one of the things we often hear is sort of what is the role of the healthcare provider in this whole area of social determinants or social drivers of health. So down here, downstream is where most medical care happens. It's providing clinical care, it's medical interventions. That's clearly where healthcare sits. We're starting to see more and more movement in this midstream area of how do you address individual social needs because they impact their overall clinical care or health. So patient screening is becoming very common. It's actually going to be a required hospital measure for PPS hospitals going forward. So do people have issues accessing housing, food, transportation, the kind of common list? How do you connect those dots? So certainly the screening can happen within a clinical setting, but then we need to have connections to other resources and organizations in the community to be able to address those needs. And particularly in rural areas, a lot of times it's not formal organizations that might be the ones that are helping sort of support and address those needs. It might be the church that holds a food pantry on the third Thursday of the month, or a certain individual that has a clothes closet that they keep available. So the informal networks in rural are really important for folks to be able to kind of understand and capture. So whether or not you have social workers, community health workers, or other opportunities to kind of connect and collaborate around those social needs, and addressing social needs as they're identified is super important. But even beyond that, there are opportunities from a rural healthcare organization to be thinking about bigger upstream community impact. And this is where I think it's important for healthcare organizations to be part of the solution, not necessarily driving it. Although oftentimes healthcare organizations might have some of the human resources available that help coordinate these things. So how do you improve community conditions? Are there kind of laws, policies, regulations, things that support health for people at all? So how does your healthcare organization have that both kind of provide excellent clinical care, think about how you're connecting the dots to help address individual social needs, but also be a part of broader community solutions to help address the bigger picture. So the transition from volume to value, we recognize it takes new organizational skills and resources. It might take thinking about some of the things that you've always done and redirecting them or rethinking about how you're using your resources. It takes investments in value-based care capacity, but we encourage people to be discriminating in their approaches. You know your own environment best. So really, what might work 2 states over or even 2 towns over might not make as much sense for you. So really be thinking about your environmental insights, being attentive to partnerships, being thoughtful about ways that you can pilot, experiment, and test, and then take learning continuously. And really encourage people to get started because there is a training wheel process. People don't go straight from 0 to 100. This is a journey, and there needs to be opportunities to kind of balance and optimize operations while you're testing and moving into new ideas. And then I would end by sharing just that rural can do this really well. I think there's strong community connections, it's a primary care base, and those are the kind of aspects that I think are really valuable as folks are moving towards this. So the road isn't always smooth, but they certainly can succeed. So our team does a variety of rural innovation profiles. I pulled links here from a handful that are kind of up in the region, the northern border region. So we have one from Vermont, one from Maine, and then one from Barnes-Kasson, who's participating in the rural health model. So really just trying to tell a little bit more of the story about what this looks like at an individual hospital. So we have about 20 other innovation profiles, but I particularly pulled these ones because of the geographic area that they serve. So I always like to end by sharing some of my favorite rural people and places, and thank you for the work that you do to improve the lives of rural people in your communities, because really that is what this comes down to. We end up, I think, a lot of times talking in the weeds about how payment mechanisms work, but the overall goal really is to improve the lives and the care and the access to care that's available in your communities for people like my parents, like my baby, who's now not that small anymore, but really it's just important to be thinking. I think it's important to remind ourselves that that's really at the end of all of this. So my contact information is here, and then I'm going to turn it over to Janice.
Thank you, Karla. So certainly that was very helpful in understanding the tools. For the last part of the webinar today, I'm going to take it up a little bit and just talk about higher level strategies. So certainly there's a lot of great work happening out there. Karla has, identified some great resources and tools. And I believe that the tools put together by Rural Health Value that Karla alluded to also are made available through our Northern Border Region Technical Assistance Center SharePoint site that we've developed. So there's multiple ways to get access to this or to that information. But for the remaining part of today, we're just going to take it up a little bit and talk about higher level strategies that need to be in existence in order for value-based work to be successful. So Karla, if you can advance to the next slide. So really essential elements for success and having led, I would say, operationalizing value-based strategies within the state of Pennsylvania. I want to share with you today some of the I'm going to say secrets of success in terms of how we were able to accomplish what we did within the state of Pennsylvania in a relatively short period of time, and really bubble that down to practical steps that organizations and leaders need to be thinking about as they embrace the journey. So, first and foremost, you have to identify stakeholders. So as Karla already alluded to in some of her slides, it does take a village. It takes a lot of folks in order to be successful. And so identifying the stakeholders, and this really needs to be a comprehensive list of who all else do I need to bring to the table in order to help me be successful in improving the lives of the community, our loved ones, rural residents, because that's what this is all about. So who do I need to partner with? And then equally important is defining a shared vision of what you actually want to achieve to ensure that there's alignment of purpose. So we often have to level set as we've worked again, not only in the state of Pennsylvania, but across other programs. It's really, really important that we remind ourselves often of what we are trying to achieve, because it is very, very easy to get distracted. And so focus through a defined shared vision is really, really essential. If we move on to the next slide, please. So really, again, in order to advance value-based strategies, there are essential items that need to be thought about and are required for success. Again, I already touched on alignment of purpose, making sure that we know what we're all trying to achieve. And so, as Karla mentioned in one of her last slides, starting with training wheels, putting your foot in the water, no matter how simple the effort, I would encourage everyone to make sure that there's the alignment of purpose, that we know what we're trying to achieve with clear outcomes, consistent and clear communication in terms of what we're trying to achieve, and then practical application. Here at the Rural Health Redesign Center, we truly do believe that small incremental changes over time can yield to really lasting results. And I think sometimes we think, oh my goodness, we have to, I like to use the term, it's not my term, I've stolen it, boil the ocean in terms of, achieving success, but really just small practical application can lead to lasting results, and it's a great place to start. So, collaboration in combination with effective planning and tactical application can yield results. So identify, practical starting points, develop a plan, and apply practical application and implementation. If we go on to the next slide. At the center of all of this work, and as I've spoken about our work now for 5+ years, at the heart of all of this is trust. And you truly do have to have trust among the stakeholders that we are all pulling in the same direction, trying to achieve the same results for the sake of the rural community that we serve. And again, that it's the bedrock, whether it's the foundation of pillars, or it's at the center of the cycle is how I chose to represent trust today. It is truly the foundation that makes all of this work. And so again, ongoing, open and honest communication is how you build trust. Ongoing humility, patience, and resiliency helps build trust. Continued demonstrated expertise and technical support. So as you work with your stakeholders, if you have the benefit of technical assistance, at your side, that demonstrated expertise that you're working with folks that know how to get from point A to point B builds trust. And then continued ongoing technical support. So in my mind, this is a practical cycle as you think about stepping into the value-based framework. It's very, very important that this ongoing cycle is evidenced within your work to continually build and maintain trust. So trust is the bedrock that makes all of this work happen. Change is scary, but working with trusted partners, all knowing that you're pulling in the same direction, is what will allow you to achieve meaningful results. If we move on to the next slide. So again, what other essential elements are needed in order to be successful on the value-based journey? This, what I'm sharing with you today, really does come, from practical experience in leading this type of change. And effective planning is first and foremost. As Karla has mentioned, this is a journey. We like to say it's a marathon, not a sprint. And anybody that has run a marathon, while I am not a runner, I have close friends and colleagues and family members that are, and you don't head out on a marathon without planning for it. There's a lot of planning that goes into to take on a journey. And similarly here with value-based, recognizing that it is a journey, you need to effectively plan. And that's the foundation. But again, strong technical skills within an implementation team. So if you're going to start the journey, who do you have with competencies, whether in-house or other partners that you can bring to the table that have the skill set that will be required in order to be effective with the change and the implementation. Understanding change management expertise. Most people do not like change. Most folks find change very uncomfortable. And so understanding how to manage that is also very, very important in terms of being successful. Relative experience in program leadership. Folks want to know that the folks that they're engaging with, the people that are leading these journeys, have experience and can speak from experience. Folks can quickly assess as you're working with them if folks have lived experience. And so ensuring it all comes down to relatability. As you're trying to lead a large scale change, folks within the team, stakeholders want to know that you're relatable and that you actually understand the journey. So folks trying to lead rural health value-based initiatives, it's very, very important that they have rural relevant experience because as Karla has mentioned, each rural community has nuances of its own. There's going to be different complements of, expertise and community partnerships and each community is different. Each community is comprised of different organizations, but being able to connect with those folks with rural relevant experience is really, really important. And then last but not least, as Karla already alluded to in her slides, data infrastructure. A lot of times by participating in value-based programs, it does give you insight or access to available or other data sources that you may not have without participation. That said, though, as you're going into any type of new arrangement, data is essential. From our experience here in the state of Pennsylvania, I can say we had to build this. We didn't actually have necessarily the data infrastructure that we needed in order to be successful. And so we had to build that along the way. How much better it is to identify your data infrastructure and make sure that it exists beforehand. But even if it doesn't, there is hope that you can build that data infrastructure along the way. But again, it takes effective planning in order to identify what those needs are. All of this also is done within a time. So you need adequate time in order to do effective planning and acquire the requirements and the infrastructure and do the planning that goes along with that. So all of this, it's not done overnight. You need a realistic timeline in which to achieve this. So if we move on to the next slide. So equally important as what I like to call hard skills is really soft skills. As you think about interpersonal relationships, it's really, really important that we have a lens of what it takes in order to be successful, in order to embark and lead this type of change. And so just pulling out on these slides, the different, soft skills that I believe are essential for any type of change initiative specific to value-based care delivery and building that new car, as Karla alluded to in the first half, is, understanding that you need to be humble. There's going to be questions asked by, stakeholders and participants along the way, and you might not have the answer to that. And being honest and transparent is very, very important, and being humble to be able to recognize that you don't have all of the answers, and that in partnership, you will figure it out. Also, patience. Change of this magnitude does take time. It's a marathon, not a sprint, as I already mentioned, and recognizing that and having patience on the journey is really, really important. Resiliency. Don't give up. You will hit, challenges along the way. Sometimes it will feel like you hit walls, but just to encourage you to keep going. There is always a way to find a path forward, but you have to have the resiliency and the determination to not give up. Always have a sense of humor. This work is very, very hard. It is very, very challenging, but choose to laugh. It is good medicine. And, good humor, a good laugh can certainly serve as a balancing mechanism, and can really diffuse tense situations. And then understanding, just recognizing that this journey is going to be hard, that change takes time, and recognizing that rural health leaders need to develop new competencies. The fee for service, payment infrastructure that has been around now for many decades does not need the same skill sets that value-based care requires. And so recognizing that rural health leaders will need to develop new skills and new competencies in order to be successful in value-based arrangements is essential in order to continue to move forward, again, in practical, tactical application within a framework of understanding. If we move on to the next slide. So again, how does this all work together? If you think about everything that I've shared so far, it really does all work together to move folks forward within relationship and trust. So again, soft skills as people, transparency, making sure that we have honest and open dialogue and communication, relevant experience and expertise, alignment of purpose, making sure that we're continually communicating and that everybody is in agreement with what we're trying to achieve, regardless of how small or how big the initiative is, understanding, making sure that everybody understands what success will look like is paramount. And then also stakeholder input, seeking that input from folks that will be impacted early in the cycle. Nobody likes to feel like they were brought to the table as an afterthought, or that it wasn't recognized the value that maybe they bring it to an experience. So really identifying the stakeholders that need to be at the table and getting their input early on in a process. All of this continues and helps with that cycle of building relationship and trust to move value-based care forward. And again, none of this is done quickly. It all requires time. So ensuring that you have effective planning timelines is also essential. If we move on to the next slide. So a couple questions that states and organizations should ask themselves as they begin to embark upon a meaningful journey. So I've heard folks say, I don't even know where to start. How do I start? What should I be asking myself? And so, questions for consideration. If you're at an organization and you think, what we need to start the value-based journey, or maybe we're on a value-based journey and we, don't believe we're where we need to be. You need to ask yourself the question, what level of engagement and interest is there at? Is present either at the state level or within your organization to take on this work? The second question, do we have appropriate infrastructure? So if you go back and think about the blocks that are needed, do we have the right leadership? Do we have the right skill sets? Do we have the appropriate infrastructure? For example, do we have data infrastructure in place, or does it need to be built? Is there an organization or resources situated to lead this work? These are the questions to ask, and then determine yes or no. Another question, what is the interest slash mood of healthcare providers and payers to embark on innovative change? So certainly the government has set thresholds out there that they're trying to move folks in that direction. That does not mean that everyone is at the same pace of the willingness to adopt it. And therefore asking that question, what is the interest and mood of the healthcare providers and payers to embark on innovative change? And then the last question for individuals, individual organizations, what is the culture of change within your organization? Is it ready? This is really, really hard work. And your culture within your organization needs to be ready to embrace that. There's the saying out there that I'm sure we've all heard, that culture eats strategy for lunch. And so if we don't have the right culture within our organization, the best laid plans from a strategy perspective will be ineffective. And so again, as you're going in, asking yourself to be realistic, are we ready for this? Is our culture ready for this? Or do we have to do basic work specific to building blocks, making sure that the organization has the right building blocks in place in order for us to be successful? If we move on to the next slide. Additional considerations. What are the opinions and attitudes about the current fee-for-service structure and its sustainability? What is the current financial position of the organization? Leadership attitudes towards population health, competing priorities, the ability to implement, and what current value-based framework is already underway that could lend itself and be leveraged, to advance. So again, these are very realistic. I try to be a very realistic person, that we have to ask ourselves fundamental questions at leaders and be very honest with our assessment of our own organizations to see and assess if we undertake this, will we actually be successful? So again, some more just questions that we as leaders need to ask ourselves. If we move on to the next slide. If the answer to these questions is no, then the question becomes, how do we get an understanding? Or maybe I think the slide says I can't actually see the top of my slide because the portion of the webinar is blocking it. But I believe, the script at the top is, if the answers to this question is I don't know, then the question becomes, how do we get an understanding of the current state? So what resources and planning are necessary to assess the current state, whether that might be a gap analysis or whatever might be required. And then what is a responsible timeline to begin assessment, planning, and implementation? So again, if you don't know the answer to the questions, that's where you start is, okay, I need to do a gap assessment. And actually the value-based readiness assessment that Karla shared about in the first half of this is a great place to start as it relates to that gap analysis to determine if you're ready or where there's gaps in order to be successful from a value-based planning perspective. If we go on to the next slide. If the answer to this questions, is, I think it's no. What does it take to get there? And so what are the known barriers at the present time? What efforts and planning would it take to begin to move in that direction? What resources, funding, and human resources does it take to begin advancing the work? And then what is a reasonable timeline? So again, asking, doing that value-based readiness assessment and layering these questions onto that. So if the answer is no, and that shows as a gap, then the questions become, okay, what would it take in order for us to move that no, we're not quite ready, to get it to a yes, we are ready? So again, questions to help from a planning perspective. If we go on to the next slide. I'm just sharing with you a list of consideration for who you may need to embark on this journey. So obviously hospital leaders, local boards, corporate leadership, etc., primary care providers, community providers, state organizations. Going back to something Karla said at the early point of this webinar, as part of her, it takes a village. And so this is not meant to be an exhaustive list, but just examples of, the organizations that our hospitals had to engage in the state of Pennsylvania as they began this value-based transformation journey within a global budget framework. Who are the stakeholders that we need to engage along the way in order for our communities to be successful? So again, just giving you an idea of a place to start, certainly not meant to be exhaustive. If we go on to the next slide. So some closing thoughts that I just want to leave with you, and then we will certainly open it up to questions from the community is, we all know that there remains a crisis of healthcare equity in rural America. There will be continued political legislative attention to develop solutions. For me personally, leading this rural health initiative has been some of the most meaningful work that I've encountered in my professional career. And I just really want to encourage everyone that finds themselves in a rural health leadership role to really embrace the journey and be part of the rural health solution. For me, again, it's been some of the most meaningful work. And as we sit here in the Rural Health Redesign Center, we certainly want to be a resource to those that we work with, specific to helping develop the infrastructure and set folks up for success. And I really just want to encourage folks to engage and embark on the journey. And we are here to support you along the way. So with that, I believe that concludes our formal presentation, and I will turn it back to our colleagues, Tom and Josh, to facilitate questions.
Great. Janice and Karla, thank you. Very well done. A lot of information. And again, if you have a question, please enter it in the Q&A section of Zoom. We do have one question, and I'll read it real quick, but the literature on the outcomes of Medicare Advantage seems to be quite mixed. The limited networks and limitation of authorizations, as well as the skewed enrollment demographics, appear to be more geared to value for the payers than value for the patients or community. Should we be really aiming for 100%? And Karla, I think that references a slide you had in your deck.
Yeah, so I don't know that I don't think the intent is that 100% of Medicare beneficiaries are in Medicare Advantage. What that slide was referencing is that CMS is looking to have 100% of Medicare Advantage payments to providers be in a value-based arrangement, and 100% of traditional Medicare. So CMS is really kind of pushing down the accelerator on both sides of that payment house. So it's not necessarily that they're pushing to have everyone in Medicare Advantage, but that they want Medicare Advantage payments to be in a value-based arrangement, if that helps. And I agree, there's Medicare Advantage is, an interesting animal. And I think that we're, especially as there gets to be more and more Medicare Advantage in rural communities, I think in the early days of Medicare Advantage, we mostly ignored it in rural because it was so rare, but it's not rare anymore. And it varies widely across states. I'm in Minnesota. Even in our rural counties, about half of our Medicare population is in Medicare Advantage. So it's really, as we start to think about these models, it's just we keep kind of splitting the population into smaller pieces and trying to manage smaller pieces, which is really challenging for small rural organizations. And that's an opportunity. But I don't think the intent is that to get everyone in Medicare to Medicare Advantage. So.
Again, if you have a question, enter it in the Q&A section. I do have a question, Janice or Karla. Can you share a best practice a rural hospital has implemented as they've moved into value-based care? Something that maybe you've observed that hospitals really done well to really begin that journey.
You want to start, or do you want?
I'm happy. So I would say, I'm a firm believer is you can't manage what you can't measure. And so using their own resources, especially, starting the journey in your emergency room, building, even if it's rudimentary, off billing system information, patient registries to actually identify those that are high utilizers of emergency room services, and then identifying the reason why they're coming into the emergency room. Oftentimes, the clinical diagnosis that's actually on the claim is not necessarily the root cause. And so, again, a practical step is, let's look at your emergency room utilization. Identify those folks that are coming in multiple reasons or multiple times over the course of a month. Assign someone to them to actually, connect with the patient and see, get to know them as people. I think a lot of times we see them as just data and numbers, but behind every claim is a person. Getting to know them as people. What are the issues? From experience, I can tell you both when I was a rural health leader, when we started this, it was amazing what we learned, why folks were coming in, and then assigning, whether it's a social worker or some type of a care management resource to that to actually help that patient work through their barriers is the biggest step forward, in my opinion, that you can make in starting the value-based journey. Again, it's understanding and without tracking and understanding, who these people are, it's going to be really, really hard to make meaningful change. So that's, to me, the best practice that I've seen is it doesn't have to be sophisticated. We can build some, pretty simple reports. It doesn't necessarily come out of the hospital's revenue cycle easy. But, there is expertise certainly, within our team here that can help build, I'm going to use the term rudimentary reports that can be hugely impactful as you start the value-based journey. So that's how I would answer that. Karla?
Yeah, well, I definitely agree with that of don't let perfect get in the way of good enough. Get to where what you need. Another thought that comes to mind for me is sort of around that, and I think Janice really talked about this, but that internal and board level engagement and education. It's really hard to move these things forward if you don't have people using the same language to talk about the same thing. So how do you kind of embed that, not just across kind of the top leadership, but your managers and your staff? So, what are the types of employee forums? How do you get to kind of just some common language about how to do this? And then the other strategy piece I would encourage people to think about is if you're not in the place where you're looking to kind of have a value-based arrangement, particularly with the shared cost pieces, there are things that you can be doing that are useful under a volume arrangement. Improving quality measures never hurts. Improving patient experience is never going to hurt. How do you kind of think through what are the kind of just best practices in delivering care? And sort of the happy accident is that those things are also useful for value-based care. So the patient engagement, patient experience piece, I think, is just absolutely critical. And so how are you capturing that information, whether or not it's through formal surveys, informal surveys, and how are you using that? Because that is not only going to help you move forward in a value-based care environment, but in rural communities, word of mouth is really, really important. So if you're providing excellent care, that's going to bring more people in your doors. So that's another place that I would start.
Great, thank you. We have 2 minutes left, so I'll give each of you 1 minute. And if you had to, for the participants today, give them one specific thing that they should take away from today to go back to their organizations and maybe consider working on, what would that one thing be? And Janice or Karla, whoever wants to start first.
So I think the trust piece that Janice highlighted is just absolutely critical, recognizing that this takes time, starting to build those relationships. Who are you already talking to? How do you start to lay out a plan for building that trust? Because I just think that these things take time. And if you're not already thinking about that component of it, it's not going to happen overnight.
I would encourage people to take a very realistic view ask themselves, do we have any type of a value-based strategy at this point? Yes or no? If the answer is yes, do we know what we're trying to achieve? And if, the answer is no, is there any appetite to take it on? And again, be very realistic, because certainly the journey is hard. And having that very realistic starting point, again, alignment of purpose. You're not going to be able to align folks if everybody doesn't agree with what you're trying to achieve. So that would be summarize, take a very realistic view of your organization, ask if you have a strategy. If the answer is no, do you want one?
Great. Janice, Karla, thank you very much for your insights and sharing your expertise today with the group. Again, just a reminder to those that attended, this session has been recorded and will be available after the session on the CVent site. So again, thank you to Janice Walters, Karla Weng for your insights and information today. And Josh, thanks for your logistics, and I wish everybody a great rest of the day. Thanks for participating.
Thank you.
Thank you.